All right, Carrie, thanks. We asked you to send us your questions about the coronavirus, and this morning, Dr. Darrin from Kansas City University is back to answer them. So we've got a lot of questions from viewers, and so we'll start off with this one. What is your advice about taking kids to playgrounds, to, getting on the swings, the slides, those sorts of things? Is that safe?
Yeah, well, I think it depends. The biggest issue with that is they're not regularly cleaned, and kids tend to rub their faces and their noses and put things on those handles and everything else that's there, including the benches. My advice right now is that people avoid them. We just don't know, and now that we have a number of positive cases in Kansas City, we have to be very cautious about that, so I would find alternatives.
Yeah. When do you expect that we're going to see a decline in overall numbers? Right now, it's every day we see new numbers. Yeah,
and those numbers are going to continue to change, and this is a great question. The challenge with this is that we are in the process of containing and mitigating, because those are in our arsenal of what we can do to help prevent this, but it also tends to extend that peak period. This virus is going to peak. It will peak. The question is do we want it to peak and hurt our infrastructure and the healthcare system, or do we want it to peak where we're not harming people? The real question to ask is, how long do the vulnerable populations need this help? That's the real question. And it's working so far, but it is beginning to strain the system, so we have to continue to be vigilant.
Okay. For those with autoimmune diseases, how high risk are we, and how much self-isolation should we be practicing?
Yeah, this is an important one. Autoimmune diseases and anybody that is taking a medication that might suppress your immune responses to viruses, bacteria, anything that really insults the body, are at risk. They are very vulnerable, and that's because that is our defense system. That's what we use to stay alive and to do all the things that we're doing. The challenge we have with this is what you were just talking about. What's the right distance? How much should we be doing? You do have to take extra precautions. People with autoimmune diseases have to pay attention to that. They should not be stopping their medications if they're on medications to suppress their immune system without talking to their doctors, because that can have consequences that they might not know about. It's very important to continue to wash your hands. This is where if you don't have water near you, use your Purell gels or other gel sanitizers. Socially distance. The one thing I am getting a lot of questions about is, should that person be wearing a mask? And still, unless you have COVID, you probably shouldn't be wearing the mask, because there isn't really a lot of evidence that says it's going to make a difference. It's best to socially isolate.
Okay. If caught and you get rid of it, can you catch it again?
So this is a really interesting area of study right now. If we look at what's happened in China, Japan, and South Korea, we actually see patients who seem to have been reinfected, but what we look at, it really looks like they just might not have cleared it, and they're just having the same infection exacerbate again. Now, there are actually monkey studies and other studies that are going on right now that are looking at this, and it does look like that once you mount your immune response and have the antibodies, that you should be protected and not get it again.
Okay, and that's good news. Thank you so much. Wonderful questions. Thank you all for sending those in. Thank you to Dr. D'Agostino. He is going to be back with us next week, so this is your chance. If you have questions for him, go to our Facebook page, share those questions with us. We'll be right back after this.